to our event today. Our theme for today is strengthening surgical safety. And this event is a joint initiative between Smile Train and Lifebox, the so-called Smile Train Lifebox Safe Surgery and Anesthesia Initiative. Lifebox is a leading global nonprofit that improves safety in surgery and anesthesia in both low and middle-income countries. And we thank Lifebox for the initiative today. We have the head of communications, Lifebox, Kitty Jenkins, with us. Smile Train is a leading nonprofit that normally takes care of children, comprehensive care of children with deformities, special deformities in particular. And we are happy with both Smile Train and Lifebox for today's initiative. And I would also like to thank specifically Sarah Hamilton, who is the programs coordinator or programs coordination manager. Couple of formalities for today. Number one, any questions should be written in the chat. And if time allows, we may ask you to contribute. And secondly, this discussion is being recorded and it will be posted online. And in addition, emailed to the participants. My name is Dr. Tom Osundwa. I'm a consultant oral and maxillofacial surgeon, chair of the Medical Advisory Council, Gertrude's Hospital, senior lecturer and founding member of Smile Train Africa Medical Advisory Council. I am indeed delighted to turn to our speakers today because we have very, very good speakers who have been chosen from all around the world. And I would like us to know the names of the speakers and where they are from. The order for the introductions will be as follows: Professor Derbew, Dr. Gathuya, Dr. Negussie, and Susannah Schaefer. So please go ahead with the introductions. You will tell us your name and where you are.
Thank you, Tom. I would like to thank the organizers, Smile Train and Lifebox, to give us this opportunity to discuss on this special issue. My name is Miliard Derbew. I'm a pediatric surgeon, professor of surgery, and I'm the CEO of King Faisal Hospital in Rwanda, and also staff of Addis Ababa University School of Medicine.
Thank you very much, Professor. Dr. Gathuya, please come in.
Sorry, I was muted. My name is Dr. Zipporah Gathuya, or simply Zippy. I'm a pediatric anesthesiologist working in Nairobi, Kenya. I serve on the Global Medical Advisory Board for Smile Train and also the Africa Medical Advisory Council for Smile Train. Thank you very much for this great opportunity to collaborate.
Thank you very much, Dr. Gathuya. Dr. Negussie, please come in.
Hello, everyone. Thank you all the organizers for planning this program for today. I'm Tihitena Negussie, a pediatric surgeon based in Ethiopia. Currently, I'm the Global Clinical Director of Lifebox. Welcome, everyone, for this webinar. Thank you, Tom.
Thank you very much, Dr. Negussie. Susannah Schaefer, please come in.
Thank you, Dr. Tom. Hello, everyone. I'm Susannah Schaefer. I am the President and Chief Executive Officer of Smile Train. I'm based in New York, where our Smile Train headquarters are located. And I'm really pleased to be here today to talk about our Smile Train Lifebox initiative and all of the important work we are doing in the Sub-Saharan Africa region.
Thank you, Susannah. Now, the past 2 years have been dominated by COVID. There have been several surges in Africa, especially Sub-Saharan Africa. If we look at the global context, we now are running at about 270,000 cases of COVID. That is just about 60 million short of the US population. If you look at the deaths in COVID, we are at about 5.3 million deaths. That's about 2/3 the population of Israel. If you put it in the African context, it is slightly more than the population of Eritrea and Djibouti combined. So COVID is indeed an important factor and subject to our discussions today. Just when we think we are off the woods, we have Omicron. Nobody knows how aggressive it will be compared to the Delta variant. Will it spread faster? Will the current vaccines work? So the question is then, what has been the impact of COVID in surgical provision where you are? And I begin this. For the answers, I request that Dr. Gathuya, Susannah Schaefer, Dr. Negussie, and Professor Miliard answer in that order. So Dr. Gathuya, please. Dr. Susannah Schaefer, please come in. How has COVID impacted surgical provision where you are at?
Sure,
Sorry, Dr. Osundwa. Oh.
Go ahead, Zippy. Go ahead.
Sorry about that.
Yes.
One of the things is that we have seen since COVID started, the various waves that have come and gone, and the different phases of the waves have had different impacts on surgery, even where we are. Initially, when we started, and like at this time last year, we were still dealing with stopped surgical services because people were not sure about what would happen in the beginning. And then the services resumed. And then we saw as the waves come down, then people put down their guards a little bit and surgeries go back. Patients feel more comfortable coming to hospital. Then as another wave starts, then people run away from the hospital. So it's been very seesaw-ish because of the COVID. And some of the guidelines about when to do the tests in regards to when surgery is going to be done have also affected what happens in this era of COVID. So it's really been impactful for surgery and anesthesia, even in our parts of the world.
Thank you very much, Dr. Gathuya. I think I share the same sentiments. Susannah Schaefer, please come in. How has COVID impacted you in terms of provisions where you are at?
Yeah, well, at Smile Train, we've been collecting data on the impact of COVID on our programs and releasing it each quarter. Our October update showed that we had resumed surgeries in more than 70 countries and were operating at 71% capacity compared to the same time period before COVID. So far, we haven't seen a new reduction in surgical volume in response to the Omicron variation. Just because we're not yet seeing surgical volume going down, in fact, because we're not seeing surgical volume decreasing, it makes it all the more urgent to continue to make investments and continue discussions with surgical and anesthesia providers throughout the globe to ensure that they have the resources and support they need to stay safe and keep their patients safe. Since the start of the pandemic, Smile Train and Lifebox's most urgent priority, and one of the urgent priorities of the initiative, has been to respond to the needs of our medical partners and the larger surgical community in Sub-Saharan Africa and around the world. Many of the resources that were part of the initiative's initial COVID response are continuing to guide standards for surgical care to ensure that providers are not only able to continue to provide surgery and anesthesia, but to do so in a way that keeps themselves and patients safe. The COVID-19 surgical patient checklist, which was developed by Lifebox and providers throughout Africa with the support of Smile Train and the WFSA, is one of those core resources, along with the Train-the-Trainer virtual sessions that enable health workers to utilize the checklist. We've also distributed more than 7,000 pulse oximeters across 49 countries for the provision of safe surgical care and the management of COVID-19 patients. So we'll continue to look to the incredible medical providers working around the world and on the ground to understand where their gaps are and how we can support them. Thank you.
Wow, wow. Thank you very much, Susannah, and particularly thank your organization. I think it is indeed comforting to know that these children with deformities are being taken care of, even during the pandemic. Dr. Negussie, please come in.
Thank you, Tom. As everyone is saying, COVID has got a great impact on the delivering safe surgery and anesthesia care for all surgical patients, especially when it comes to pediatric patients. The impact will be significant. And as a pediatric surgeon, since the pandemic is affecting a lot of population in the country and in the world, all those are diverted towards managing this pandemic. And in an area where there is resource limitation, diverting that resource towards one specific type of disease will have a great impact when it comes to surgical fields. And that's what we see on the pediatric patients. The admission has been significantly decreased and the waiting list is now increasing, which is impacting the outcome of our patients, also psychological trauma for patients as well as for parents. And as Lifebox, we are also advocating for quality and safe surgery services for these patients. And the good thing, we are trying to help the capacity of countries with the service by donating or by giving some kinds of equipment that we've got at hand, and also training, even though it's virtual. But still the quality service that we are planning to implement has been significantly affected, because most of the training packages that we drafted are mostly face-to-face. And when it comes to virtual, it might not address what has been planned. And also the institutions which should be incorporated and visited will be also decreased in number. And that also has got an impact on delivering the sessions that we plan to be decreased. But the good thing, the virtual thing now is increasing and everybody is becoming on board on using internet service for different kinds of training. So even though COVID is impacting and making on board all the professionals with this kind of training is improving. That's a good thing out of this guys. So yeah, thank you. And the impact is still.
Thank you very much, Dr. Negussie. Thank you indeed. Dr. Negussie is a clinical director with Lifebox. We also thank Lifebox once again. Professor Derbew, please come in.
Thank you, Tom. You know, the COVID impact, above all, from the impact of the disease itself, the response of the community, the public, our response was, I assume that we have taken more response, more aggressively or dramatically than the impact can bring to us. The moment this disease was announced as a pandemic, so everything freezed down. No travel, no work, and hospitals are almost closed. And initially, as already said, we stopped doing surgery. Then we only start doing on emergency surgery electively, but that is also with very high precautions. And then the cases which are not emergency were postponed. So we have now a lot of waiting list on the patient, as well as, you know, when you have a waiting list, the pathology also advances. Now, some of them, especially some of them like malignancies, are becoming inoperable because of that. You know, so immediate action is not taken on that for the disease. This is one of the main reasons which we have seen. And also, you know, we work mostly with partners, and partners have stopped coming because the flight is locked. Even patients coming from the countryside to the main hospitals, they cannot do because there was no transport. So this has impacted. Even unregistered impacts, which we can see are more due to this problem. But the good thing is, people are taking basic hygienes have improved, hand washing, masks, and also keeping distance. This has reduced the infectious disease, which mainly affects children, like gastroenteritis, upper respiratory tract infection. It has reduced markedly. Maybe the diseases which we lose or the morbidities which we lost because of COVID can be compensated by the life saved because of improving hygiene, reducing the infectious rate of or some common diseases like gastroenteritis and upper respiratory tract infection as well. So it has also affected training. Most of the training programs have delayed, and some medical schools are closed, which also affects training of pediatric surgeons as well. So it has impact on health workforce development. So these are the things which I've seen on top of what my colleagues already mentioned. Thank you, Tom.
Thank you very much, Professor Derbew. And while you are at that, please just highlight for us the barriers to providing comprehensive surgical care for children, both in Sub-Saharan Africa and globally.
The barriers, which is common for all, is mainly the first thing is accessibility of patients to come to health institutions. To come to health institution, what you need, mainly which you see in Sub-Saharan Africa, is the knowledge of the patients. Most patients come to hospitals after they are complicated. Their first trial is done at home. When they don't see any improvement at home, they take them to hospital. So that is the knowledge which is lagging behind, as well as the knowledge of the health professionals. Do we advise our patients to come to hospital at the right time? Sometimes we see people coming with inguinal hernia, and some health professional will send them back to come sometimes after 5 years, 6 years. But by the time, before they reach that age, they can come with strangulated hernias, which results in higher morbidity and mortality. So one is knowledge is very important. And affordability, that is when it comes to direct cost and also indirect cost. If a family member is taking his child to a hospital, and if misses the season of farming, then the whole family will be affected. So this is afraid of that, this impact, they may also deprive them to go to hospital. So or they may not be able to pay for the hospital. That is what we can see mainly in Sub-Saharan Africa. The other one is accessibility. Do they have a hospital nearby? And is that hospital or health institution, does it provide them the necessary health service they want, especially surgical services, which we are discussing now? Most of the hospitals are not able, even if they are able to give some emergency service for adults, they are not well equipped for pediatrics. Pediatric surgeries are usually pushed for, even small minor surgeries are pushed to the main hospitals because of lack of human resource we can handle, especially pediatric anesthesiologists. So that is very important also to address. So because of there is also delayed in diagnosis. Also, there is also the healthcare system is also very much well strengthened to accommodate or to give support for children. And some of the time, there is also in pediatric surgery, it is a teamwork. So the team involvement from the diagnosis, from preoperative, operative, and postoperative management, including ICUs, there are no the structural limitation is also there. There are no hospitals which have all this kind of service for pediatrics. Even those who are not well equipped. So this is another issue which brings the management of pediatric surgery in low and middle income countries very difficult. In high income countries, it's much better. So you can see most of the parameters or the surgical outcomes in high income and low income countries. You see the difference. Why this difference is coming? It's because of accessibility and affordability, and also human resource, the knowledge. How many pediatric surgeons do you have in Africa compared to other countries? Especially in Sub-Saharan Africa, we have very much limited pediatric surgical services. So these are the main points which you have said, which affects pediatric surgical service in low and middle income countries in Sub-Saharan Africa in general.
Wow, wonderful, Professor. Is there any hope that things are changing or that things will change?
Yes, yes. There is hope. Of course, we live with hope. Now, if you see the world politics is about globalization. So when you see globalization, whatever new finding done in one corner of the world, it can go, whether you like it or not, to the other corner. So any development, improvement in treatment, and will be easily, information can easily be transmitted to any part of the world. So those countries like Sub-Saharan Africans will get benefit from this globalization. With the globalization also there is partnership, like the partnership we have with Smile Train, with Lifebox. This partnership, this partnership not only help us in our capacity building, they also help us, getting instruments, machines, and equipments which can help in improvement of the surgical outcome of children in Sub-Saharan Africa. And the techniques also, technology is growing fast. And now having pulse oximetry some 10 years ago was very, very serious issue. Now we have almost no surgery is now being done in most of Sub-Saharan Africa, thanks for Lifebox, without pulse oximetry. Now we are working now for capnography. And this is another technology development, not only the development, but also the spread, the access for other Sub-Saharan Africans. This is another issue which you see with the technology development, what you have seen, mortality going down.
I agree with you, Professor, that a good number of the gaps have been filled. And when you talk of the gap in capnography, it just reminds me that we are with Dr. Gathuya. Dr. Gathuya, what do you think are the main gaps in the provision of safe anesthesia, both in Sub-Saharan Africa?
Dr. Tom, Zippy's just lost her connection. She's reconnecting, but maybe go to the next speaker while we wait for her connection to come back.
Thank you very much. Thank you, Kitty. We'll immediately go to Negussie. Negussie, are you with us?
Yes, I am.
Okay, please explain what you mean. I know you are the guru of surgical site infections. Please explain the impact of surgical site infections on patients in the low socioeconomic income countries. Welcome.
Thank you, Tom. So surgical site infection is one of the nightmare, not only for surgeons, but also for whole staffs in the hospital, as well as for parents and patients. So when it comes to SSI in lower income countries, it's significantly higher when we see different literature reviews from high income countries. It can range from 10 to 14% in most of the literatures, but it can reach up to 40-something% in some countries. So when you see this number or this figure, it's showing you that it's one of the devastating complications which we face and one of the avoidable complications which we can entertain. And the impact of SSI in our patients can range from simple morbidity and as well as affecting the economic of the country. So the morbidity can be an ongoing complication which will result in sepsis and end organ failures, and to the extent of mortality, as well as difficulty in managing these patients because of the surgical site infection. And when it comes to mortality, it's one of the things that can happen in a patient who has got surgical site infection. And when you see different programs, especially which is developed by Lifebox, which we call it clinical program, there is a place for reducing surgical site infection with simple intervention without significant cost. So when I say cost, because of the management, because of the need of antibiotics, because of the need of dressing, because of the need of persistent, long duration of admission and readmission, the cost implication to the patient, the parents, as well as the hospital and also the country is significant. So if simple intervention is addressing this, then the Lifebox come up with a clean cut program, which was initiated in 2015 in Ethiopia. And the piloting study in 5 countries shows there is 35% reduction of surgical site infection from the baseline, with improvement in adherence towards the 6 standard perioperative infection prevention pillars. And these 6 pillars are appropriately using WHO surgical safety checklist, properly doing skin preparation, properly making sure that the drape and gown integrity is there, antibiotics administration is the right way, gauze counting is properly done, and finally, instrument sterility is confirmed before any kind of surgery. So keeping this in mind and addressing this by simple observation and simple communication with the teamwork, it significantly reduces the relative infection risk of the patients by 46%. So by that, what is the additional outcome we get from CleanCut is the team spirit, the teamwork and communication spirit of the perioperative staff significantly improved. Previously, the nurses and the surgeon or the anesthetists are not communicating in the right way, or if they are communicating, it's not towards the patient's outcome line. So that communication spirit improved. Everybody has got a say, which is significantly impacting the outcome of our patients. So with that simple intervention with low cost, the cost is just dedicating ourselves for keeping on addressing those standards and making sure that availability of our service for the training, which will help for keeping the standards by our staffs. So availing time, dedicating ourselves and commitment from the administrators in the hospital has resulted in significantly improving and accomplishing the CleanCut program in their institutions. So with that outcome, with that improvement, everybody is interested. And now we are planning to expand the program by adapting towards the different types of subspecialties, as well as the different cultural contexts that the country is having. So the initiative of Lifebox and Smile Train working together, now we are trying to adapt this CleanCut program for cleft patients, which will automatically has significant impact for pediatrics patients, because most of the cleft patients are pediatrics patients. So we will change the culture of services in reducing surgical site infection for pediatrics patients. So that's what I can say from CleanCut, and it's one of the simplest strategy, but with a greater outcome, improving the teamwork and communication skill in the perioperative team. Thank you, Tom.
Wow, I think that is very significant, because if you are going to reduce surgical site infections, you are eventually, with an organization like Smile Train, you are going to help them have more money to treat the actual disease and concentrate less on surgical site infections. I think you are doing a wonderful job, Dr. Negussie. Thank you very much for that. Susannah Schaefer, please. I want you to tell us about your organization and what you are doing in terms and in relation to both safe surgery and anesthesia. Susannah Schaefer, please come in.
Yeah, thank you. Well, I will take a lesson from my colleagues in medicine. To be effective, an organization in global health must treat the symptoms and the disease at the same time. We can't just support a child's surgery or even 1.5 million children's surgeries and call it a day. We must also ask why and address why a child didn't have access to safe, high quality surgery and anesthesia in the first place. So addressing that question and having a sustainable long-term impact is only possible through partnerships and through local leadership. If you want to support safer surgery and anesthesia in Kenya, support surgeons and anesthesiologists in Kenya, listen to their needs, the challenges, and the solutions shared by the medical providers and communities who are working and living within these systems every day. Support national advocacy and support implementation hand in hand with the governments who will be leading these investments in the future. These are the values that have underpinned both Smile Train and Lifebox's work, as well as our partnership. And that's why I'm so honored to announce that our colleague and partner, Professor Miliard Derbew, will be serving as the global ambassador of the Smile Train Lifebox initiative in 2022. Miliard, throughout your career, you have advocated for children requiring surgery. We are beyond delighted that the initiative will be guided by your expertise and leadership to ensure we achieve real impacts in improved surgical and anesthesia care.
Thank you very much, Susannah. And, thank you very much, Smile Train and Lifebox, to have a trust on me and also to recognizing me. I take this appointment humbly and of course with honor, and I'm glad to be Smile Train Lifebox Global Ambassador. But I know it is difficult, especially it is difficult for me to fit in the big show of Atul Gawande, who was the ambassador before me, and but I'll try with the help of you to fit in this position. I'll continue doing advocating for children in general, especially for pediatrics and in pediatrics, as well as especially on Smile Train and Lifebox activities. Lifebox is one of the world's largest cleft charity, and the peculiar thing about Lifebox is not only doing the surgery per se, the disease, as we have said right now, it is also building the capacity, the local capacity to address the problem that, now we have many general surgeons doing cleft lip, plastic surgeons, and also your contribution in developing surgical training in Sub-Saharan Africa is highly appreciated. And also my organization, Lifebox, identifying the need for safe surgery and doing all the possibilities to have surgery to be conducted safely, whether mothers, children, all kinds of surgeries. So working on human resource development in anesthesia and surgery, as well as technology distribution and accessibility, by providing pulse oximetry, and as well as capnography now, and also many are coming forward. So thank you very much, and this will give me more strength to work and to dedicate my work in promoting children's surgery in general, but especially on cleft and Lifebox activities.
Thank you very much, Professor Derbew. Indeed, as a fellow surgeon, I feel proud that you are stepping into these shoes. And I think it is a very good initiative that is both by Lifebox and Smile Train International. And I believe that it is working to empower. For those who may not know, the WHO checklist has a connection with Lifebox. And I think currently there's also the COVID checklist that has a connection. And so it's all about improving safety and care. Congratulations, Professor. I think we now have Dr. Gathuya, who will tell us about the main gaps in provision of safe anesthesia, both in Sub-Saharan Africa and globally. Dr. Gathuya, are you with us?
Yes, thank you very much, and sorry about
yes,
that.
Please come in. That's okay.
I lost my connection for a while. Once again, thank you very much for this opportunity to speak, and I'll address the gaps in some big themes, and then we look at how each of those affect us. The number one thing about safe anesthesia and surgery I cannot go without saying is about patient selection. And there are so many things that feed into this aspect of patient selection. And so long as you haven't selected your patient correctly, then it doesn't matter what else you have, you may land into trouble and not offer safe anesthesia and surgery. So we must emphasize the need to select our patients correctly. Once that has been done, then we address the other gaps as we know them. And one of the main things is about infrastructure. And we need infrastructure that can support the provision of safe anesthesia and surgery. We need provision of oxygen, like has been brought forward in this core area of COVID, about the need and the deficit that we have in, especially the anesthesia oxygen ecosystem. The other thing about infrastructure will be about water. Again, in our setup, water has become very, very important. And electricity. And those are things that in some parts, especially in Sub-Saharan Africa, are quite glaring as gaps. Then we come to monitoring equipment. When we talk about monitoring, I think this is the one area that Lifebox and Smile Train have partnered very well to improve in the provision of safe anesthesia and surgery for children, initially with pulse oximetry. And now we're in the process of making an affordable capnograph. And we hope that this will be distributed to all the Smile Train partners, but will improve care, not only for Smile Train patients, but the whole of the surgical system where surgery is happening, especially for children. And we hope that this is already at a very advanced stage, and just like the pulse oximetry has been distributed and has helped a lot in saving lives and improving the quality of surgical and anesthesia provision, that the capnograph will also make the same impact. And we are very, very excited to have been part of this program between Lifebox and Smile Train. And even as we come to the second year, we are looking forward to more of this collaboration. The other thing that cannot be left behind is about workforce. And I've seen somebody commenting about the training of anesthesia in our parts of the world. In our part of the world, more than 50% of the population is pediatric. And we really need to improve the workforce to make sure that people can offer safe anesthesia to the patients that they come in across. This is a long-term goal, but we have to think about the low-hanging fruits that we can get. We are talking about the short-term gains that we can make. And again, Lifebox and Smile Train are working on the provision of the safe feeds. And now we are working on another program called Save Cleft. And then there is also the Safe OR. And all these things are short courses that are helping people in the short term improve their skills in taking care of children or going through anesthesia, but also improving teamwork, like we have been told previously, that this is very, very key. On the long term, we have to think about increasing the training of physicians and non-physician anesthesia providers long-term in the care of pediatric anesthesia. And because we know that this gap is so huge and the few fellowships we have may not cover in a long time, we must think about how to improve the skills of people who are already providing anesthesia with skills that they can offer safe anesthesia for pediatric patients, even without having to go through the fellowship, and making sure that even all the people who are being trained in all our training facilities have better equipped skills to take care of children who are going through anesthesia, whether or not they finally end up taking a form of pediatric anesthesia fellowship or not. But everybody must improve their skills in giving anesthesia to these children. The other thing that is very key and has been a major gap is airway management. And this especially for Smile Train, because most of our patients, we have a shared airways with the likes of Tom. So we have to make sure that people can really take care of a shared airways. The cleft palate particularly sometimes provides a difficult airway. So this is a major gap, and there has to be intentional address to this issue of airway management. And then the other major gap that has been identified and is being addressed, especially by Smile Train and Lifebox in tow, is about systematic resuscitation. So once you have a problem in the operating room, how do you recognize that you have a crisis, and how do you deal with that crisis? And that is why Smile Train has partnered with American Heart Association to offer for most of its partners basic life support and advanced pediatric life support by our own providers, so that this gap is addressed. And once people learn to work as a team in identifying, the most important thing is to identify that you have a problem and then solve it systematically and be able to use it. How do we manage our patients in the PACU? So like Professor said, there's a lot of gap in knowledge, and fortunately, Lifebox and Smile Train are working very, very hard to address this gap in knowledge through the funding of COSEXA, CANEXA, short courses, and other things that are happening, fellowships, facilitating people to go for conferences, hands-on workshops. There's very, very many ways that these two organizations have worked together to make sure that training is advanced and that this gap in knowledge is addressed properly. And the other thing that I have to say, and this is coming to an end, I'm just finishing, is teamwork. Okay. I have finished.
No, actually, I was going to ask you a question. You are not off the hook, Dr. Gathuya.
Tell me.
I think Henry Bukwirwa from Uganda is asking you, what strategies can you use to increase the use of the WHO surgical safety checklist? What are your strategies? How can you improve the uptake?
Okay, thank you very much. This has already been identified as one of the main things that alone.
So sorry, I think we lost her, but we can quickly go into Professor Miliard. Professor Miliard, how do we improve uptake? How do we improve uptake of the WHO checklist in our setup?
You know, the WHO checklist, which we have been using before, is every time we're updating it and to use for the purpose. Now we have, it is also modified during the COVID time. And it was initially for the surgical team on the table. Then you have got checklists for the anesthesia team, now involving, and it was initially on the beginning of surgery, there's also at the end of surgery. So every time the WHO checklist is being updated depending on the needs and also the problems which we face and which we want them to stop. I mean, not another problems not to happen again. So it is based on that. That is how we are improving all the time. It's a dynamic thing. It's not something which is set one.
I totally agree with you, Professor. What I also think that hospitals need to append this checklist to their standard protocols, so that if theater is going to begin, you cannot cut without signing, without timeout, and you cannot wheel the patient out without sign out. I think one of my wishes is to really have this appended into hospital SOP, the standard protocol by which hospitals operate. And how about stakeholders like governments? And this is particularly to Susannah Schaefer. How do we rope in governments? How do we involve stakeholders in and letting them invest in safe surgery and anesthesia? How do you work with governments? Susannah, please come in.
Thank you, Dr. Tom. For us, it's really involving them from the start and from the beginning, and working with our medical partners like you and others who are joining me on this panel to advocate for access to care, for us, for cleft treatment, and the ongoing treatment for cleft that's required, so our cleft patients can go on and lead full and healthy lives. Advocating for safer surgery and making sure that our partners have the equipment, have the resources that they need for treating children in their own communities and patients in their own communities. For us too, it's about advocating for health system strengthening. And, you know, for our hope at Smile Train is that our work over the last 21 years has been making an impact in this regard. So we're advocating for cleft patients, we're advocating for advancements in global surgery and safe anesthesia care. And that helps us to strengthen our cleft programs, which overall strengthens health systems. So the connection with governments and advocating for care and educating governments on this important work is absolutely critical and valuable to our global programs.
Thank you very much, Susannah. I think being one of the people who work under you, I think working with the governments ab initio at the beginning makes an impact, because you make them part of what you are doing. And I think that strategy is a very good strategy, and I echo your organization. I think Dr. Gathuya, you are back with us.
I'm very sorry. It looks like the internet has determined that I will not speak.
We want to know how we can improve uptake of the checklist. How do we make people, yes.
So like I was saying, you need to have a champion in your operating room who runs with the surgical safety checklist. And that has been shown to work very well. The other thing is to have meetings, team meetings, and actually highlight issues where using the checklist could have saved a situation. For example, there's a throat pack that has been left in situ that caused a problem. This may have been picked with using the surgical checklist. And you have to be also careful, because sometimes what I have seen is that in the enthusiasm of people to make sure that they have the checklist in every patient's file, sometimes it just gets ticked without even being asked anything. And you find that you're starting a case and already swabs have been counted and closure done. That's not the way to do it. So I think it is commitment from the team, having a champion who is a team leader to make sure that this thing is done and done correctly, and having a debriefing sessions to see how it can be done better. The other thing is just to benchmark with some places where they're doing a good job. And I'm sure, because we have had a lot of training about the surgical safety checklist, if in particular, like Dr. Bukirwa, there's a specific problem, you can always liaise with Smile Train and Lifebox, and we can do the training of trainer that we have done previously on the use of the surgical checklist. Susan, I just committed your money. I'm sorry.
Wonderful. Now, now that you are with us, Dr. Gathuya. What is your take on viral filters and anesthesia and safe surgery?
Okay, so viral filters are very, very important, and especially in this age and era of COVID. I mean, previously we've had instances where people are not very keen about using viral filters, but especially now with the COVID virus, with community spread, with not universal testing for everybody, it is very, very important for all patients to have viral filters. Most of the ones that we have in the market now are combined viral and bacteria filters, which are also okay. And I'm sure in line with offering safe anesthesia and surgery, this is, with the discussion, this is something that Smile Train can especially offer to their partners to make sure that they have enough viral filters for their patients. And this will also go a long way in infection prevention and also the clean cut thing, because it's a whole circle of things. So they're very, very important. And I know we have many ways of doing shortcuts with them, which I shall not discuss online, but I think it is suffices to say that we need to really advocate that we have viral filters for all the patients that we operate on.
Thank you very much. I think, Dr. Negussie, you've been quiet. Tell us about a little more about your clean cut initiative. I think people want to hear more. Okay. How many, which countries have you gone to?
So once we see that there is a great impact of clean cut initiative on the reduction of surgical site infection, we also started implementing this program in different countries, currently in Africa, but in the near future in Southeast Asia as well as Central America. So the countries which already started are Ethiopia, Liberia, and Madagascar, and they are already doing the post-intervention phase, and also the final program is done in Madagascar. The Ethiopia hospitals, we have got close to 13 hospitals by now who already implemented ClickUp, and the impact is significantly seen. The good thing about it, because we are working on teamwork and communication skill to address these standard pillars, the sustainability impact of the program is already seen in our newly published literature, which is assessing the sustainability program of different KY programs, which we assessed in the 8 hospitals we implemented ClickUp. All the 6 standard pillars have been improved after the intervention, even after 6 months of the program is over, with significant ongoing improvement of this compliance towards these standard pillars. So with that, QY programs, even if the program is ended by the implementing organizers, if you are working on teamwork, if you are working with the professionals, the sustainability impact of the program will continue. So it won't be over once the program is over. So with that impression, we also started implementing the program in different countries, and the same is seen in Madagascar, and also the program is continuing in Liberia. Soon we'll start implementing in India and also in in Bolivia, but we will continue doing it in all LMIC setups till we see there is significant reduction in SSI in all the countries globally. Thank you.
As I said, thank you very much, Dr. Negussie. I think it's a noble venture. The question that begs now is, what do we hope to see in 2022 with regards to improvement in both surgical and anesthetic care, and in particular, Sub-Saharan Africa? For me, I think I would like to see much more uptake of the WHO surgical safety checklist. I would also like to see an uptake of the COVID-19 surgical patient checklist that probably should be appended to the first. And so I will invite our speakers for today to just tell us what they hope to see in 2022. And I will start with Susannah Schaefer. Please come in.
Sure, thank you. I hope first that there will be increased vaccine equity, because that is key to protecting health workers and patients alike. There cannot be surgical equity without vaccine equity, and we cannot increase access to comprehensive cleft care globally without strong, resilient health systems. I think this year has also been a critical time for important conversations around equity at every level, within healthcare service delivery, within research, within representation at conferences, and for representation in medical textbooks. I hope that over 2022 and every year moving forward, we continue those conversations and increase action to correct the global imbalances that affect providers and patients in low and middle income countries. And as we're talking about Sub-Saharan Africa today. And then I know we don't have much time, but a closing thought, and what I think is so important, I think everyone have also experienced the lack of those personal connections that are so valuable and meaningful to all of us. And at Smile Train, I know that we miss most those in-person connections with our medical partners and patients with clefts. And I look forward to being together in 2022.
Wonderful and well said, Susannah Schaefer. Now I'll probably just go to listen to one final comment from Professor Miliard Derbew. What do you think, what do you hope for in 2022, Professor?
I want to see the world free of COVID, no vaccine, no nothing. I wish that. And, you know, I would like also to see safe surgery being implemented or in most of Sub-Saharan African countries, and to bring the gap of mortality and morbidities in high and low income countries, to narrow these gaps. So I hope this can be achieved. It doesn't take a long time as before, because I told you we are at the time of globalization. We'll bring this gap narrow. That's what my wish is.
I think, Professor, you've already started your campaign on your new position. You're already working. Thank you very much to the speakers. Thank you so much for the brilliant contribution each of you has made. I think your genius has been epic. To our hosts who are Smile Train and Lifebox, thank you for the initiative and keep it up. And to our beloved audience, our best wishes for the end of 2021, and we look forward to partnering with you in 2022 as we strive for safer surgery and anesthesia, and as Professor Derbew said, a world free of COVID. Thank you, everyone, and it's been my pleasure to be with you. Have a wonderful year.
Thank you, Tom.
Bye-bye.
You are a wonderful moderator.
Thank you.
Thank you, Dr. Tom.